Hello everyone, myself Dr. Varun Goel. I am consultant medical oncology in Rajiv Gandhi Cancer Hospital and Research Institute, Rohini, Delhi. Today we are going to discuss about ovarian cancer. First of all, what is a cancer? In a normal human being, normal cells grows, divides and then replaces by other cells in a normal, regulated and controlled manner. But in a case of cancer, these cells grows indefinitely without any regulation in uncontrolled manner and forms a tumor which may be benign and malignant, and this ovarian cancer is usually malignant. So this is the cancer which develops from the ovaries and fallopian tube, which are female reproductive organs, and this is the second most common type of cancer developing from female reproductive tract cancers, and it usually develops at the age of around 63 years of age. So what are the risk factors for development of this cancer? First of all, age is this cancer usually occurs more. Second risk factor is obesity. In obese patient and in overweight patient, this cancer may occur more. Smoking is a risk factor. Besides these, in a patients with a significant family history, if in a patient in mother or sister or other family members, if there is any history of any ovarian cancer or breast cancer or other cancer like colon and endometrium cancer, then these persons, these females, are of more risk of development of ovarian cancer. And another risk factor is use of hormonal replacement therapy, particularly if a person use estrogen only hormone replacement therapy for more than 5 to 10 years, then this cancer develops more. There are some factors which decreases the risk of ovarian cancer, like in pregnant, if a patient is have been pregnant and have done breastfeeding to her child, then it decreases the risk of ovarian cancer. So what are the presentations of this cancer? Usually this cancer present with vague symptoms, and usually in the initial phases there are no symptom or vague symptoms like bloating of the abdomen, abdominal distension, nausea, lower back pain, lower abdominal pain, differences and disturbances in bowel frequency and urinary frequency. And usually these vague symptoms remains unnoticed, and patients take some symptomatic treatment, and then this tumor advances and usually diagnosed in advanced stage. So how we can diagnose this cancer? If a patient in a patient of these symptoms, we should do thorough physical examination, and then some radiological investigations like ultrasound abdomen, CT abdomen or MRI abdomen can be done. And if there are any ascites or ovarian mass or other omental nodules and other lesions, then we may order for tumor marker like CA125, and we may go for ascites paracentesis, ascitic fluid cytology and cell block, and biopsy from any omental or ovarian lesion. And then after microscopy we may found some cancer cells, and we may diagnose this cancer. So what is the treatment options for this cancer? Usually in most of the patients, initially surgery is planned for these cases, and we usually remove ovaries, uterus and peritoneum and other lymph nodes of this patient. And after that, depending on stage, although in most of the patients adjuvant chemotherapy is recommended, and in some patients, if patient is old and morbid, then we may go ahead with hormonal treatment only. And in initial stage patient, if patient diagnosed early, then adjuvant treatment is sufficient and patient is cured. But in advanced stages, patient may recur back after some time or maybe after a few years, and then we may have to give some chemotherapy at that time, or maybe addition of some immunotherapy or targeted therapy in the later stages in the recurrent and metastatic ovarian cancer patients. So what we can do to prevent this cancer? Obviously we should do some changes in our lifestyles. We should do regular physical exercise, and we should maintain our weight, and we should avoid smoking. And if there are any significant family history, then we must go to our physician and doctors for regular health checkup to detect this cancer if happens in early stages, and then treat accordingly. Thank you.